to get the most for a dollar. That's part of the human condition. And within healthcare in the US, we're trying to do that same thing. At the same time, we have an element of lack of transparency for what all of this good quality care is costing. So you have people wanting things that if they actually knew the price, they may think twice about what they're asking for. So for me, value is really what's the best quality I can get for the dollar I'm going to spend, okay? Some areas of my life, personally, I like higher quality things. I'll spend a little bit more for higher value things. In other areas, maybe not so much, okay? But when it comes to healthcare, we usually have one or two problems for each of us. So we want to make sure we have the highest value, highest quality care we can get for the best price. And that's a combination of just not high quality care now, but that continuum of high quality care, high value care later as the disease progresses, whatever disease that may be, hypertension, high cholesterol, diabetes, heart disease, any of those, they'll modulate over time. So keeping your eye on the ball for what's the highest value at that point is key. And that will drive, I think, that value equation not only now, but for the next 5 or 10 years. And what that is not just medications, because we know medications work, but some patients are at some levels of adherence, some levels of compliance, or in certain disease states may not provide as optimal a result and outcome as we'd want, or that we can get with other medications. So the value equation will be one of those algorithms that have a variety of factors and that will need much larger data and actually people caring about looking at the data to find the answers. We're trying to take personalized medicine, in other words, very much, a provider and a patient working closely together on their care plan and trying to scale that up. It's very difficult to do. Matter of fact, it may be, they may be pulling in opposite extremes, okay, for that. But I think that we're moving forward, we're moving the ball forward, we're figuring out how to get a handle on value-based care. And I think that using the most clinically effective tools on the front end and monitoring those and using whatever tools are available, that is like mobile apps and patient engagement tools, will help us to be able to get those transition points and those times when we need to change care so that we can kind of ride the wave of high value care delivery through the entire spectrum of the disease. Medical science liaisons have been used within the pharmaceutical arena for quite some time. The reason for that is it's not just a brand name that's splashing on a TV or on a page of a paper, but usually behind it is a lot of detailed information and data that it can get lost if it's not carefully explained and walked through. It's all based on science, it's all based on clinical evidence and usually peer-reviewed published work, but many times usually having one person actually sit down across the table or talk through on a fairly scientific and very detailed level about the data. That's kind of the role of the medical science liaison. And it's not only important for pharmaceuticals, but it's also with the advent of new device technology. Those MSLs, or those interfaces that are highly clinically trained and that have experience within that area to work through the details, and there are a lot of details regarding the use, the utilization, the outcome data, even the clinical trial data with users of the device or with purchasers. That may be a hospital system or a large group practice, or the purchaser may be a health plan or the federal government that's buying this. It's very important that the level of detail needed to make those decisions is actually brought to light.